Hi Stanford, how are you?
I'm great. Not in pain. Not in pain, so good. How about you?
I'm good actually. Tonight I think we're gonna just have a little bit of conversation about back pain. Is that
Yeah,
correct?
absolutely.
And then back pain comes into several categories, doesn't it? So you've got sort of that sort of common lower back pain, that sort of aching that people get in their back, and you've got sort of lower back pain. Then you've got chronic lower back pain, which is actually slightly different from lower back pain. And then you've got sort of I see, quite often back pain into the upper area, so up into the sort of upper shoulders, neck area between the shoulder blades, um, so into the neck. So I think we've got sort of these are sort of for me the common areas that we have back pain. Um, the reason back pain is of interest to me, I went to see someone last week, and he had back pain, and I said to him, "So how did you do this lower back pain?" And what I was doing is I was getting him to stand, and he's as he was standing, he was kind of leaning forwards, like his body was all just leaning forwards completely and utterly. He just couldn't straighten himself up at all. And I palpated his spine down, when you do palpation on the lower back,
Mm,
and I felt all the vertebrae and that lumbar area, that kind of the lower lumbar area that should be sort of, it should have a nice lordotic curve, this beautiful, wonderful little curve, and all the vertebrae should be in line with each other. I mean, it was jagged. I mean, it was like all going in the opposite direction. And I was like, oh, I said, how did you do this? He's a really, really nice, sweet guy. He said, I was deadlifting 160 kilos. I was like,
mm.
oh, that'll do it.
Why?
Exactly. And I think this forms part of this because quite often what we find is that there's numbers of different reasons we get back pain. Lots of different reasons we get back pain. And some of it comes down to structural issues or inappropriate awkward use, as we'll come to discuss within the different case studies we'll talk about tonight. And then you've got excessive use of the body, such
Mhm.
as excessive physical training or creating some kind of pushing action with the body where you take it to an extreme. And
I think repetitive movement probably fall into that category as well.
yeah, and then you've also got insufficient use of the body, so or a lack of physical maintenance. So they're kind of like the sort of as you'll find from other cases that we'll discuss tonight, is that actually, some people just don't move the body, and because of insufficient use, is an absolute disaster with it. So I as I was palpating this and I was just feeling this guy's spine, that all this heat was coming off it. You felt the muscles either side, um, and how tense they were. I was looking at his face and his position. I was like, in out of 10, how's the pain? He was like 9.
Okay.
This is quite serious. So it so for me, I come across on a regular basis back pain, and it isn't just purely physiological. Often I come across it where it's psychological, also psychosocial as well. So you've got this kind of impact with regard to our society too. So,
Mm.
firstly, what is back pain? What is back pain from your perspective?
So from a medical perspective, is any pain that is on the back line of the body, that is on the back line, not the whole of the body, the torso. So as you said, it can be around the shoulders area, which is kind of the upper back, mid back,
Mm,
which is kind of around towards the base of the ribs, but also towards the lower back, all the way down to the coccyx, so down towards the tailbone. And very
mm,
interestingly, sometimes actually, because how nerve works, as you know, sometimes the one area actually refer their pain to another area. So sometimes, say, like in pregnancy, when the
mm.
pelvis get a little bit more um, mobile as the
Well, yeah.
pregnancy actually progress, and actually the weight of the body increases because the baby and the placenta and everything is growing.
Mm,
So actually, sometimes the pressure that the pelvis have to endure creates some sort of discomfort or painful sensation. And that often, when I used to work in maternity, I can see that I actually would say the pain was felt in the lower back area when we know actually the cause is somewhere else, maybe slightly more towards the front of the pelvis or towards one side of the joint. Sometimes this is much more rare. It's actually pain due to a deeper structure. So inside the abdominal cavity, pelvic cavity or even the bony structure. So it's not quite in the musculoskeletal layer, which is usually where pain is felt.
Mm.
But I really like your definition, how like you lined up what chronic back pain is very, very common. And it is common. It's like about, I think, 50% of all working adults will have at least like once a year kind of thing. So it's quite common. But that's defined, chronicity is defined by pain that has been endured for more than 6 months at a time.
Right.
So
Okay.
or sometimes, actually, no, sorry, 3 to 6 months, sorry. So sometimes it can be more than 12 weeks as well. But sometimes it can be just an acute pain, which is like, let's say you lifted something in an inappropriate position, you didn't bend your knees properly enough, and actually you put too much pressure into your back and cause acute pain.
But then there's, you see, I think there's a distinct thing here between something like lower back pain and chronic lower back pain, because in one way, what you're saying within something being chronic is that actually it's been going for a long period of time. And I find that interesting because actually, when you look at back pain, most back pain resolves itself quite quickly. Quite often when you rest things, when you create a cycle where you look at the steps that you've taken, the activity you've taken, you reduce the activity or change certain things. Because for me, back pain comes into 3 different camps, 3 different areas. One is that, I was with a lady this week, and she was doing lots and lots and lots of driving. And she was, driving, she's got 3 children. She was driving here, there, everywhere. And she's like, my back is so absolutely in huge amounts of pain. And all we did is we did just a very, very small practice with some stretches, just activated the parasympathetic nervous system. We made sure that everything was okay, settled the muscles, settled the body. And she was like, I'm out of pain. I feel so good. And so for me, this is the first sort of camp or group of people. And it's where we kind of we have an understanding of what the cause is. We understand what they've gone through, and we then put in place a number of different things which actually, can really help the situation, and they get out of pain. So they come out of pain very quickly. Then I was with I work with another lady. She's got extreme scoliosis, so she's got a structural issue within the spine, and she's also hypermobile, and there's a weakness within the muscles as well. And she's also definitely got one leg longer than the other. And for her, she needs to do a practice every single day. She has to work on her back every single day in order to make sure that actually she reduces the pain and gets out of pain. Because for her, pain comes at night quite a lot. And then it comes on later on in the afternoon. So time of day is also quite interesting in this as well. And then I've got someone else who, no matter what happens, they just seem to be in pain in their body all the time, especially in the back. And yes, breathing helps. Yes, these other things help, but actually the pain is still there. So for me, it's just kind of like these 3 areas, these 3 sort of categories that I find and come across quite a bit as, working with people with back pain. What do you see? What's the sort of patterns that you see quite a lot with regard to this?
So I think I see more of the people in the second and the third category, because I think usually if people can do something small or something change of habits and actually get themselves out of pain, very often they don't get to see their doctors. So actually, even as a psychiatrist, we very rarely see those people, and or they will mention, now something has happened a few weeks ago, but actually it's now much better, and there's nothing much for us to do, or there's no pain for us to examine, like how you explained earlier on. You've helped pay the person's back, and actually there's something physically causing the issues. The second camp we see quite a lot. So as you described, scoliosis, so that's a kind of a lateral, so sideways deviation of the spine. And also maybe there's a discrepancy in the leg length actually causing a lot of problem, because when there's asymmetry in the body, it means one side of the body might have to work harder, as you obviously know. And then one side may contract more, one side may be shorter, one side may have to get a little bit harder just to support the structure in that way. And very often it creates a pain in that way. Now, interestingly, as I mentioned, I'm a psychiatrist. So the pain that I see quite often nowadays actually is in the third camp is whatever you do, they're in pain. I just had this client told me the other day, literally, I think over the weekend, he had a surgery a few years ago about one of his joints, and because it's constantly pain, the doctor told him you need to, get this surgically corrected and sorted. He told me as soon as he woke up, he was in pain and from surgery. So exactly, that was my reaction. Just like interesting, because that tell me even when we give you the most drastic intervention, we can't get you out of pain, which suggests to me there's something deeper.
Interesting, because normally when you look at sort of something like a back pain, what are the variables involved in it? You've got the spinal bony structure itself, so that's one thing. Then you've got the discs that are then in, that's another thing, and you've then got the muscle wraps around that and the way the nerves wrap around it as well is another thing. The majority of things that I see is I tend to see a huge amount of tension in the top part of the body, and I see all of the mobility in people's backs coming from the lower part of the body. So I see on an ongoing common basis, what I tend to see is I see a huge amount of tension across the shoulders, the neck, and often this comes from, the world, the weight of the world on the shoulders, driving style, desk style, quite often responses, like physical responses to situations where people will just naturally tense their shoulders up just as they go in towards to do something. So automatically, there's this kind of movement into the shoulders in this way. So I tend to see a huge amount of tension in the top part of the body. Now, if something's tight and tense in the top part of the body, what happens is that when they want to turn around, when they want to do any different thing, all of that goes into the lower part of the body. So actually what's happening is that the lower part of the body is actually compensating for all the movements that should be done in the top part of the body. So what I tend to see often massive amounts of tension there and increased mobility in the lower part, which causes a huge issue. And so when we start to look at the structure of the spine, I'm kind of almost, because of the tension in the top part, there's almost overuse in the lower part. So it's doing much more than it actually should be doing. So from my experience, rather than focus on the lower part in that situation, I tend to focus on the top part to take the pressure off that area. So then it has a knock-on effect into the lower area. So it's kind of interesting. But when you start to look at the spine and look at the variables of what happened, and for me, an accurate diagnosis is hugely important, because I think one of the issues is that we tend to do lots of guessing. And guessing is we can't actually see inside a body from looking at it on the outside. We can see the effects of things like, yes, we might have sciatic pain, so a pain down the back of the neck, or femoral pain, like they're pain down the front of the leg. Or we can do various different, there's huge numbers of tests and checks, aren't there, for back pain? Yeah, which is kind of interesting. And I think we really need to sort of begin to understand what is going on with something, so that we can really know what we need to do about it, and actually how we need to change our lifestyle, or change the way that we're doing something, or work with what we've got in order to actually reduce the pain.
I find that fascinating, because almost like the saying goes, we do carry the weight of the world around our shoulder, isn't it? Because when I see back pain, we, as doctors, we usually very much focus in the lower back. We will examine the whole of the spine usually, but maybe we would less focus on the tension around the shoulder. So I think in yoga, I see that more, but in medical world, it's not something that I would tend to examine, which is fascinating. We do the palpation just like you would. We ask the people to actually mobilize and show the range of movements. And also we often would do scan, as you said, like x-rays, but actually one of the better scan, or one of the best scan for back, is actually, as you know, is the MRI scan, because it differentiates between the bone, which is quite a dense structure, and the muscles and sometimes the nerve quite nicely. But what you have explained makes so much sense, because with the weight on the shoulder, actually all the weight landed on the back. and it causes a lot of the issues that I see quite commonly is a disc prolapse or prolapse disc, as you know, or disc rupture sometimes, because the disc is like a gel. That's how I got. I'm not a spinal surgeon, but it's how I've been explained to me is it's like a gel-like structure that's in between the bones. This shock absorbent, it actually allows the bone to move quite nicely. It's a bit bound so that, or the jelly doesn't quite move out to the side. And on the side of these gel disc, and as well as the spine itself, there are the nerves. The problem is, as you described, if you're having lots and lots of weight on the shoulder and you're basically overusing the top half of the body, putting a lot of pressure into the lower half of the body, plus any sort of slightly less good angle of movement, like a lot of the times like lateral movement or rotational movement, it can really cause issues into the disc, causing it to prolapse or rupture. So that's the thing that I see quite often, actually.
Right. So what you find, and what I've come across quite a bit, is I've come across damage to the facet joints. So actually, just the joints that connect the spinal vertebrae together. I've seen quite a bit of damage there. I've also come across a huge amount of different variables with regard to discs, and you can have a disc that moves in any direction. So a disc can move, it can move to one side, it can move to the other side, it can move diagonally, it can move backwards, it can move forwards. And basically how the disc moves is the person will show you by the way that they actually, what they favor. So, quite often the person's stance will actually show you, what's going on with the discs. And sometimes I've seen it move. I've seen it completely compressed. I've actually seen it completely disintegrated as well. I remember one of my first X-ray situations where I was working in a clinic, and everyone brought their X-rays in, and one chap, we saw his X-ray and put it up onto the screen. Yeah, and as we got it up there, it was like there was no disc in there at all. But guess what? He was in no pain. And he was only forced to come into the clinic because of his family. And then actually the next case that we had after that was really interesting, because he had a huge amount of pain, but when we put his X-ray up there was nothing. We could not find a single thing. So this kind of begs the question for me, what pain is, because when we're talking about back pain, pain for me, pain is the body's only way of communicating with you. The body has to be able to communicate something. So it's telling you that you need to identify something or identify what's going on. Is there, quite often we will have a feeling that within back pain that, and quite often people will say, oh, the pain is all across the lower back, and I'll say, well, is it more on one side or the other side? They said, no, it's all across the lower back. And actually, as we come to go through and assess the person, suddenly they'll go, actually, it's on this side and not the other side. And so we start to begin to uncover lots of things about what the body is telling you, because pain can actually be pain, or it can be referral, like you said earlier, from another place. It can refer from somewhere else. Or that's what I find quite interesting. Sorry to jump back into pregnancy. I feel quite kind of, could you also, with the weight of the baby, could you also get quite a lot of movement within what sort of back pains occur within pregnancy?
So in pregnancy, I think it depends on the trimester. More advanced you're in the trimester and gestation, the more so the weeks that you are pregnant, the more advanced you are, most likely you have more pain just because of physically you have more weight. Yeah. But sometime in the second trimester onwards, so it's like something like 18 weeks onward up until about 24 weeks, maybe even 30, all the way to 32 weeks. Sometimes it can be a bit of ligament, so like internal ligament get trapped. And most of the time you feel at the front, but sometimes occasionally I can hear people more to the side and slightly felt in the back. But more often than not, but the pain comes in the last trimester, so the third trimester, when the weight is really quite a lot. So babies are at the front, so the big tummy, and babies more in the front. So then the back has to work really extra hard in order to balance the weight. And as you described, sometimes you can see almost like exaggerated lordosis. So you see more of a curving inward of the spine going forward to balance the weight. And again, I've described the pelvic pain already, where the joint itself is slightly more mobile and so like the mobility actually can cause a bit of discomfort as well.
Mm.
Is that what you mean?
Yes, because I find it quite interesting because we've got a natural situation where we actually don't need to prepare for childbirth. In fact, we don't need to loosen any muscles up. And remember that the ligaments and tendons only have what, 5% mobility to them.
Yeah.
Yeah. So actually, we're better off not loosening them. We'll let the hormones do that for them. Do you see what I mean? Because actually, when you start to overstretch something, then you create another issue.
I agree. I think the body has a really good mechanism and wisdom in how it works. So in pregnancy itself, most of the time, as you said, the hormones and that natural process and development actually prepare the body.
Mm.
I think slight caveat is I think nowadays, especially if you work in a city, if you have a really busy lifestyle, as you said, then you sometimes have to do certain things in order to counter posture. Those things almost, I'm using a yoga term here, a counter posture. Let's say if you are in a job where you get to sit in a chair for 5 to 8 hours a day and you don't actually get to mobilize a lot, which is what we're meant to do. We're meant to be walking around every now and then, mobilize a little bit, or you're on your feet all the time because you're rushing so much day to day for your job, or getting ready for your maternity leave, getting ready for your home, or you are moving home, which seems to be a common thing that I've seen in my antenatal clinic.
It's a very common thing, isn't it? How, if you look at all the stressful things that you can put into one thing, is that you need to move home,
You have to redecorate.
decorate, change job, do numbers of
Yeah.
other different things all at the same time. But there's a lot of stuff that goes on there because you've got this body that's going through these changes. You're going through those changes as well. You're creating that relationship, but you've also got this huge amount of pain that starts to come in. You've got sort of like discomfort in particular places. You've got that numbness in the feet, pins and needles in certain limbs, and so there starts to be sort of numbers of different symptoms that come up as part of this, and not just in pregnancy. What sort of symptoms? Because pain is the body's way of communicating something to you. And it could be that it's communicating to you that actually you just need to do some movement. Or it could be communicating to you that actually the pattern that you're taking, there's insufficient use of the body. So you're sitting at a desk for 8 hours and actually you need to change the pattern of what you're doing. Or, you've done that for a certain amount of time. So what kind of symptoms are people experiencing with back pain?
So I find pain fascinating because, as you know, in NHS, we actually dedicate a specialist clinic to pain, a pain clinic, because I think everyone's pain experience is so different. There are really sharp and sudden pain where, as I said, if you pull muscle somewhere, it's tend to be quite focused. It's right here on this part of my back, on the right side, 2 inches above here where you're poking. So very, very, very specific because something is hurt and damaged. But then there's most of the time pain can be quite vague, as you said. It's like, not quite sure it's the left or right, maybe it's more in the middle, actually it's slightly further up, slightly further down. It's kind of like achy, kind of comes and goes, don't know when it comes, don't know when it goes. It's a bit throbbing at time, it feels warm. So there's loads and loads of description, and almost like most of the other pathology I've seen, almost no two pains are the same between two people, or sometimes even within the same person, the pain evolves.
We break pain down into those areas as well. So we classify pains as 3 different areas. The first one is a kind of like a kind of like almost a random pain. And this random pain, it comes, it goes, it moves from place to place. It doesn't form a rhythm. And then we also put pain into kind of like sharp and burning pain. So it's kind of like it's targeted, it's sharp, it's burning. There's a specificity with it as well, and it's there. You kind of it creates that sort of response where you don't want to move at all in case that pain comes. So in fact, that pain actually causes a barrier with some people with regard to doing movements or looking at getting better, because actually they just do not want that sharp pain ever again to go anywhere near them. And then you've got this kind of deep underlying deep throbbing pain, you know, that kind of sort of like really deep within the system that is there. You know, so it could be on the left or the right side, often the lower back down to the buttock area, just something like that, where it's kind of like this deep throbbing thing, or in between the shoulder blades, or on the top of the shoulder blades, the scapular area, this area here. I see a lot of deep throbbing pain there. Sharper pain I see more in the center of the back and also into the lower back. And random pain I see all over the body.
Randomly.
Yeah, randomly.
I find your description how people anticipate pain is a very important element as well, because I think emotional and psychological factor plays hugely into pain. There are loads and loads of study that shows a person who's suffering from depression and anxiety, they tend to experience pain more severely. They will raise their pain higher usually in general. But also I think this anticipation, almost like the fear of pain, does make pain worse. I occasionally still do blood tests because we need to do a lot of monitoring for like liver function, kidney function, or drug levels. Some people are really scared of the needle, and I almost find more often than not the anticipation, the fear of the pain that's coming is much worse than the actual small needle that's going into their arm. Right. And once you've done it, it's like, oh, actually, it's not as bad as I thought it would be. So that is very fascinating as well.
But this is very much linked to the nervous system as well. Really linked to the nervous system, because if you think about it, it's a stress response. And so what's happening is that there's the anticipation of pain, and that is combined with the memory of pain and also the direct experience of pain that they've had. So we've got this kind of this sort of, what do you call it, a tripod, a triad of kind of, you know, you've got these sort of three things that are coming together all around pain, which actually, yeah, it's exactly like that. So you've got these three sort of things coming together about pain that actually it almost stops someone from sort of moving forward. They just don't want to go there. Because I've actually come across this quite a bit where people have had and do experience pain, but actually don't want to deal with it because they don't want to get to be flared up, to get worse. You know, when they do anything about it, suddenly it increases. So I think that actually there isn't a set formula, or I haven't seen a set of movements. And I always get asked this, you know, it's one of the questions I get asked is that, you know, is there, which position is really good for back pain? I'm serious. You know, actually, believe it or not, is breathing is better for back pain than positions. You know, it's very, very, you can do amazing things with gentle movement and breathing, incredible things, but it has to be done in the right direction for what's happening with the person. So there isn't a formula or even a set of movements that miraculously get a person out of back pain. And I think that what you discussed earlier is that actually all spines are different, and that means that the issue itself is different, and that means the solution needs to be different rather than actually a generic solution applied to it. Does that make any sense?
And I think in the West, more and more we are also recognizing that gentle movement and breathing, gentle breathing is actually helpful for a lot of conditions. Just before I joined, I was reading one of these newspaper in my medical journal where we're recognizing that sometimes after like a COVID infection, you have a lot of shortness of breath, like breathlessness sensation. Actually, one of the guidelines is saying with guided or, you know, careful, gentle movement and breathing actually can be helpful. So I really agree with pain. I think it's the same as well. There's a gentleness in both the movement and the breathing, but that can really help the system much deeper. Because like you said, it's a stress response to the pain that can make it worse. But if it's an acute stress response, let's just say, for example, someone get into a car crash, very often you see people walking out of the car as if they're not really in that much pain, because the shock of it actually raising the adrenaline and the cortisol and steroids actually make the body almost a little bit numb, and because the body's response like you either have to fight or you have to run away. So actually there's no time for you to kind of experience the pain. Right. Now, the interesting thing is the same person, like 3-6 months down the line, get behind the wheel, having a bit of memory of what has happened and transpired, because they probably will feel the pain in their body later on. That pain, that stress response incorporated with the memory, like you said, is going to be so much worse, even when the stimuli itself or stimulus itself is actually not that much.
Interesting. So for me, approaching this, and the approach to this, I think, is important, because again, the question comes, what do I do about my back pain? My back pains so much back. What do I do? And almost when we're in pain, there's an urgency. There isn't any patience at all, is there? So we go around and we try 37,000 things, one thing after another after another. And is it the culmination of all those things that helps, or is it that actually it's the time frame that helps, or what happens to get us out of pain? So I saw someone recently who their spine, they just felt like their spine just collapsed. And in yoga, there's the terminology for the back is that which supports you. So that's what it's translated as, that which supports you. And as I was explaining it to them, they said that's exactly how it's felt. I felt that I had my support taken away and my back just collapsed completely and utterly. And as we were discussing this, we were going through this, we were sort of looking at, okay, we've got this situation. Is it just a purely physical approach with regard to this? Or is it that actually our approach needs to be very psychological? And I think that at the moment, you've got a number of things that are going on. And I think that, as you were discussing earlier, we need to look not just physically, but we also need to look at the psychology of back pain as well.
As you're saying that, my mind gone off a slight tangent, which hopefully is relevant. As you said before, pain is the body's way of communicating to the body where there's something that's not quite right, something that either is a discomfort or inappropriate use, overuse, underuse that needs to be paid attention to. I actually also find that in at least people that I meet or clients or patients, pain is a very good and effective language of communicating what is actually deep in their system to another being as well. Because if I tell you, actually, I'm suffering a lot, this is happening to me, that is happening to me, it just like that's how the pain presents sometimes is quite vague, it's quite hard to be understood. But if I'm telling you I'm in pain, it's actually really effective because the other person most likely will have similar experience one way or another of having pain. They can get to actually understand. And it almost invites attention to that person. It's like, oh, what do you mean by that? What else can we do? How can we help?
But also, I mean, it looks at a number of things, because it looks at that type of thing. So putting ourselves in the hands of another person, and whether we actually go down that route to put ourselves in the hands of another person, or whether we put ourselves in the hand of another person, but yet don't want them to help with regard to the issue, and we want just to be looked after. One of the biggest sort of pieces of advice that I give is that approaching back pain is actually it's a huge opportunity to actually make friends with the body, because quite often there's some things happen, there's some sort of disconnection that's occurred, and almost in a way the body's let them down, or they're punishing the body, or they want to separate from the body. But actually, in order to work with it, the first step for me is to actually begin to make friends with the body, which means that there has to be quite a bit of kindness, gentleness. There's got to be almost we'll use the word compassion, a compassionate approach. And compassion is it's there isn't an expectation. It's a very caring, gentle approach to working with the body. And quite often when I discuss this, people tend to get quite upset, because they realize that actually they've been fighting, or they've been ignoring, or they've been pushing, or they've been not feeling. And it's a pattern that they've created within their lives, but it's also a pattern that they will pick up on when they want to sort out their back pain. It's like, I need to go and see this, I need to do that, I need to do the other, I need to get and actually, are you just taking meds? Are you just hoping for the best? Are you avoiding the whole thing? Or are you actually looking to change the interaction that you're having with yourself? And I think this is a kind of like a very important thing for me with regard to back pain. And it's how we'll use the tools. So how I'll use breathing, or how I'll use gentle movement, is to actually teach someone how to make friends with themselves, how to get some success through movement. So there's a reduction of pain, or there's a pacification of the nervous system in a particular way.
It's then also approach that sometimes you actually have to introduce people to the concept of pain as well. Like the client that you mentioned, who you saw the X-ray where almost the one part of the disc or the back is actually disintegrating and he feel nothing. Because that to me almost signified that that person is this almost like dissociating from what is happening to his body or her body or their body. And how is there then as part of the way to help that person is to introduce them to the concept of what is actually happening, meaning you probably should be in some sort of pain.
And the question is I'll ask this quite a bit. How are you feeling? What do you feel? How does that feel? How does this feel? And not obsessively, but I'll be doing it so that we get this kind of connectivity, and we'll use lots of touching with regard to this so that someone gets a sense of feeling in their body, comes back into their body. Because quite often, you know, that there isn't that feeling, you know, there's a blocking out of pain that happens. Now, pain, is there anything I need to know about nerve synapses and pain?
So nerve synapses that's the kind of how one nerve communicates to the other nerve, or one part of the brain, one part of the nervous system is connected to another one. So it changes by electrical signaling. So it kind of one sets off the other, and then the next one gets set off so that it get passed on. And these all happen very, very quickly. Different nerve thickness of nerve, and if they are wrapped by certain sheaths so that they can help with conduction and things like that, carries different information. So some nerves are carrying information about heating, some nerves are carrying information about pressure, proprioception, pain, sharp pain, like more diffuse pain. But one thing that's very interesting, I know we talked about this quite a few times, is actually what's the interesting thing about the nervous system had this almost like a neuroplasticity. So the more you signal about something, the more you almost reinforce it. So if the pain synapses has been, you know, fired up so many times or been reminded of so many times, both physically, psychologically, emotionally, actually get stronger and get fired up even faster next time.
Right. So in fact, by us focusing on the pain, we reinforce and increase the growth of nerve synapses associated with that painful area.
Very much so.
Interesting. So distraction is a very good technique as well.
And placebo is also a very, very good technique as well, as I found.
Really?
I've seen a program once, I think it's on BBC, where I think a GP get invited to someone's home and actually look after someone who has chronic back pain. And this person on a lot of medication. So in pain medication, you have so many different varieties. You have like as simple as paracetamol. Then you have something that is like a non-steroidal. So usually your ibuprofen, things that are very, very helpful because they take down the inflammation, but at the same time can potentially cause other issues like bleeding, ulcers in your stomach and things like that. But then you can move even stronger towards your opiates, so that your weaker opiate like your codeine and stronger opiate like your morphine, or even all the other fancy things that you can use as well, gabapentin, so on and so forth. So this GP visited someone who's suffering so much pain, actually on quite a few of these different painkillers. And then they found, just like we discussed, sometimes the pain almost have no pattern. They can use certain painkillers, like strong painkillers, the pain still wouldn't get reduced too much. Sometimes they use something as simple as paracetamol and ibuprofen, the pain is almost completely gone. And actually he was like, well, why don't we just humor me? Why don't we do a little bit of experiments, like for 2 to 3 days, I think, which is kind of unlabel everything. We standardize most of the tablets, and you just take like a different regime, and I'm going to ask you to rate your pain. The person who take the painkillers and who's suffering pain wouldn't know what medication he actually is taken, but actually after 3 days time, it's like, well, since you have no pattern, let's experiment and find out. And as discovered and confirmed, actually there's almost no correlation to the painkiller that he used to the pain that he's feeling. So that's a huge amount of psychological influence into it, and placebo plays into it as well. Sometimes the thinking of have taken some painkillers actually can also help with the pain.
Right. So in fact, we need to begin to differentiate structural issues from psychological issues. Because
Yep.
actually, you have a structural issue that becomes a psychological issue, or a psychological issue that can become a structural issue. And
Absolutely.
I think,
Psychosomatic.
and there's also got to be some honesty around the whole thing as well, because I think that it, we've got to, if what we're doing is that we've got this issue, this back pain issue has come from, so it comes from somewhere, whether it's hereditary, whether it's come from misuse of the body, whether it's come from insufficient use of the body, whether it's to do with any structural imbalance or issues, whether it's to do with inappropriate use or awkward use of the body. There is a reason for it, and there is also a way of working with it as well. But it means that we have to be able to use the body in a way that doesn't increase the issue that we've got. So if I push very, very hard, like let's say, actually I've got back pain, and what I do is I do bouncing forward bends every single day to stretch my back out. And yes, the first few of them are really, really painful, but after a while, the pain goes. And I think, well, that's a good, that's really helped. And I'm sort of bouncing with the body really, really hard. But every day I wake up with back pain. It's almost that our approach is actually increasing this issue.
Mm.
And so we have to discover something new about ourselves. We have to sort of begin to realize how do we actually come to create and do movements, and then have an awareness about how we come to create and do movements, because certain movements, as I discovered when we're looking at back pain, is that probably the majority of back pain you can help with one particular direction within the body. There's a minority which is in the other direction of moving the body. So one with regard to flexion, the other with regard to extension of the spine. And so when we're starting to look at the actual structure and working with the structure, it can go in several different directions. But if it's psychological, then we need to be quite clever in our approach. And that cleverness means that we have to change the relationship the person is having with themselves and how they have with that movement as well. And that takes some honesty. Because they have to identify what's agitated and what works well. And they have to really consider about looking to maintain and protect what they've got. And quite often we want to sort of improve what we've got again and again and again. And we get frustrated with the fact that we've got an issue, rather than think that actually we need to protect and maintain what we have.
I think you're talking about what direction of the body is taking actually potentially can cause the pain is a really good one. Another one that just came to me is also what is the pain preventing us from doing as well, which is another one. Just for humor, 40% of they miss day off from work is actually caused by back pain. So maybe work is a big factor. I don't know. But the clinical example that made me think of what I just said is I think a few years ago, I saw a lovely lady, mid-50s, who lived with her teenage daughter. Very, very sadly, she slipped in her shower, I think. And so it caused quite a lot of like bruising in her back and things like that. So it causes a lot of pain. She also suffered a little bit of low mood as well. So that's partly why I've seen her. Unfortunately, over the course of the next 6 to 12 months, her pain just doesn't seem to get any better at all. She has a little bit of weight on her as well. So it prevented her to do a lot of the exercise that she can do, like with physiotherapy, to just move herself out of pain. She finds it quite difficult to like mobilize, quite difficult to walk and live. Actually, a lot of her daily functions, she needed to be supported by her teenage daughter, who I think as our relationship in care gone on, the daughter has turned 17 or 18, so getting ready towards the stage where she will leave home and going to university after having done her A-level. And that was the interesting bit. We understand the pain. We understand there's a real cause of pain. We're not trying to say that her pain is completely in her head, because it came from a slipping. It came from a physical damage. We understand the depression or the mood has helped her to have feel even more pain than usually would, and her weight might have prevented her to mobilize. But what is very interesting is the closer it is to her daughter leaving home. So like things when her daughter get the results, which is very, very encouraging, or when the daughter going to open days, going to interviews, her pain will get worse.
Mm.
And it was at one point, we have to have a very honest conversation, as you said. Is there part of a reason why, or part of like anxiety, nervousness about your daughter leaving home to university somewhere outside where not very close to where you live at the moment, actually can induce the pain as well? Because that, at least that's the pattern that we observed.
Yeah.
So I think sometimes what's the pain preventing us from doing or achieving, I think is also interesting.
And I see quite a lot of this in relationships as well, with regard to pain, and also the trap that keeps someone in pain. And for me, the question is how delicately we can tread in order to navigate this, because it's possible to come out of this type of thing. It really is.
I'm usually much more blunt than you are, much less finesse. Just answer the question.
Yeah, I've learned so much from you about being direct. Me, I'm very, I kind of, I ask a question so that what the question does is it helps the person to actually, you know, reflect on it and then come back with an idea. I've learned so much about questioning from you.
I apologize for my directness, but that would be a lie.
So we kind of, so I found that I've got sort of two different categories of back pain, those that are aggravated by forward bending and those that are aggravated by backward bending. And it's not as simple as we make them out to be. So to give an example, for the gentleman I spoke about earlier on with regard to deadlifting, you'd think that because the vertebrae were moving in the opposite direction, so they were moving in the lumbar vertebrae were moving outward, so it was almost flattening the curvature of his spine, because you remember, like you said, that the basis of the spine is that it's there for suspension, and so actually we need to have that beautiful curvature within the spine. And there was a lot of talk many years ago about, oh, straighten this or tuck this under and straighten the spine, and actually what it does is it causes a problem. So it's good to have a nice curvature. So this gentleman had this curvature, this movement that went out, and in a way you kind of think, well, what do I do with this, because it should actually be all the way in, and his body is leaning forward like that, which actually says that he can't move backwards at all. So it means that we have to then break down our approach into small steps, which involve going along with the nature of the body. So what aggravates it and what doesn't aggravate it in order to help the person. So it's creating a series of different things, and the spine will actually teach you and show you what's going on and the direction to take, because actually we need to get this curvature back again within the back. There are very rare cases that I come across where it's both forward and backward bend cause an issue. I've also found that quite often twists cause issues as well. And interestingly enough, in yoga classes is to allow the body just to freely twist. So there's how the spine is with an axial rotation is that you can work with the top part of the body to create an axial rotation, or you can work with the lower part of the body to create an axial rotation. But if I was to, let's say, in a class, to lock my legs firmly, tightly, and keep a stability in my pelvis and just move the body, what would that do within the spine?
Create a lot of tension.
Right. And so, in fact, actually, I'm using the legs as levers up into the pelvis, but allowing those levers to move based on the movement and mobility that's present within the spine. It's and when we're working with back pain, it's hugely important to remove lots of different rules that were put in place about how something should be for someone. Actually, when they're in pain, we do everything so there is no pain, no pain.
Yeah.
Which means that we adapt absolutely everything. We change everything. And so when I'm coming to look at back pain, and I'm looking at this, and I'm looking at how someone takes an approach with something, like how they enjoy to do something, I don't want to take that enjoyment from them, but I want to adapt and modify everything so that in life, and that means looking at their lifestyle, you know, as with someone recently who had a huge amount of back pain from gardening. Okay? Gardening, and loves gardening. But we say to them, you've got to stop gardening, I'm afraid. You know, you can't do this. No, we have to look at what they do, look at what they enjoy, and then adapt and modify things so that actually we provide the solutions that really help them to deal with it. So we give them small movements to do. We give them small exercises to warm up, and also at the end of the day to actually, relax the body at the end of the day. So actually they can keep doing the things that they enjoy. So the approach taken to back pain is based on, what the person does, where they are in their life, what they're involved in, what's going on with them, how the pain's presenting itself. So I think that we, and I really do believe that we are now becoming much more intelligent in our approach to back pain and much wiser with it as well. So we're actually looking to use the whole body and use everything rather than specifically work at one particular point.
So I really like your approach in, helping people to prepare for and also kind of warm down from things that they enjoy, and in order to kind of, in our approach, achieve no pain, no pain. But what if someone enjoy pain? I've met more than one person where they use pain as in almost as a conduit to feel their body. It's people who train really, really hard, people who enjoy sometimes just massage that is really, really hard, and they can feel everything. It's like, this is good, this is good. I can feel it. What do you do? Because actually, as we keep saying the whole time, we almost felt like pain is a signal telling us we need to stop doing stop doing what we're doing, or we need to change what we're doing because the body doesn't like it. But what if the person developed such a relationship that they're actually starting to enjoy the pain?
Well, then we need to go with the evidence. I remember meeting this bodybuilder, and he had really, really bad back pain. And we gave him some very, very, very gentle practices with movement and breathing. And he was completely frustrated by it, because it wasn't big movements. It wasn't powerful movements. It wasn't the movements he was used to. It wasn't the approach that he had with regard to how he could feel something being successful. However, his back pain reduced. And that evidence was humbling enough for him. However, it was in a clinic where we saw him every single day for 10 days in a row. I would say that if that had been based on me being located in London, they come to see me once and they wouldn't come back again, because sometimes this is what people do, is they kind of go, this isn't working, and go off somewhere else, because they want something where they have that feeling.
Yeah. Or sometimes they get challenged so much they don't want to come back. I remember I have a client who comes to see me once a week, where because of certain competition, like physical activity competition, they have to train very, very, very hard. And actually causes a lot of issues towards their back. In order to move themselves out of pain, they start seeing specialists who actually train in a specific way to learn how to use their knees and legs. But actually the movement that he got taught from that specialist is quite strong. So from what I can see, as you said, the evidence I can see is actually adding to the tension to the back, where sometimes he come to see me almost like walking slightly limply, and at any standing posture, he's like, oh God, this is causing too much pain. So we have to go to a direction where it's like, you just lie on your front, take the pressure off the body completely, and then we just kind of slowly do some gentle stretching one way or another and breathing, to move yourself out of pain.
So we have to understand exactly how the body is being used. I think that's a very important thing. So it's such an important point, because if there is a pain in the locomotor or the structural system, we've got to understand how it's used. So we need to understand the activities the person does, and that includes all the different training aspects that they come to do or not do. And we also need to understand their lifestyle. Okay, because quite frankly, some people's lifestyle, you understand why they're in pain. The final thing is their psychological attitude. So in fact, when we're looking at back pain and we're looking at people, we need to begin to understand these three things. But also within that is we need to begin to understand about their insufficient use of their body or their lack of physical maintenance, because some people actually don't maintain their body and wonder why it starts to fall apart. And a body is there, we have to maintain it. Some people go in the opposite directions. There's an excessive use of the body, and there's excessive training of the bodies that almost they wear everything out. So with insufficient use, we need to take small gradual steps just to begin to give some kind of success for people so that actually they can restore their strength and flexibility and reduce their pain. And in the opposite direction, when there's excessive use of the body, and that excessive use, it's not just about reducing the activity, which will come when, especially with weightlifters and in that area, but to pacify the pain, but also to begin to look at the understanding why that person wants to destroy themselves. And the final thing is looking at structural issues. And I think that within structural issues is how we can put in place various different things that can help with body coordination, can create greater awareness. Yeah, it's a hugely interesting area.
I think sometimes as well as psychological, there's a bit of cultural shift as well. Because I remember a few years ago, I was training up for a cycling trip from England to France. And as I was training, part of my body started getting a lot of pain because I injured it many years ago. It was part of my knee, part of one of my knee. And I remember a very lovely teammate tried to help me to move, train with this pain. She's like, just keep training, just keep going. We have to, keep cycling, keep moving, push through the pain, and you get better. That's how you get better. And I think that's this mentality as well, where actually I met more than once in different kind of physical training, physical activity, where almost we need to push through the pain boundary or pain barrier in order to get better. Because I know this teammate means really, really well, and they in no way were trying to hurt me. But something innately, as she says, like it just doesn't quite make sense. I think pain is probably telling me that I need to stop. So I really like your approach of no pain, no pain.
And I really like your understanding with regard to physical, psychological, and also psychosocial. So the impact of our society on this as well, because there's a lot of things at the moment that create pain. And we're, rather than look to ourselves to navigate a way out of it, often we'll look to someone or something else to try and find a quick fix to get out of it. And actually, pain provides an opportunity for us to begin to understand ourselves and to have a better relationship with ourselves.
I think this is the perfect point to end today's on.
Oh, hey, good to see you.
You too. And for those of you who are listening, please feel free to subscribe, share, and tell other people that we're here. Thank you.
Thanks.